The infectious disease is spreading rapidly, and the latest reports are frightening. My colleague, Paul Sisco, has more on the West African Ebola epidemic.
In 1976, the virus was discovered along the Ebola River in the northern part of the Democratic Republic of Congo, then Zaire. About 150 died in that first recorded outbreak. Over 1,000 Africans lost their lives to the virus between 2000 and 2010. This Ebola outbreak began in Guinea, spread quickly through Liberia, Sierra Leone, and into Nigeria. It's claimed well over 1,000 lives in about 6 months. Fedela Chib is a spokesperson with the United Nations World Health Organization.
Between 14 and 16 August, a total of 113 new cases of Ebola virus disease, as well as 84 deaths were reported from Guinea, Liberia, Nigeria, and Sierra Leone. The governments have set up quarantine zones in areas of high transmission, including severely affected cities such as Kikidu in Guinea, Kenema and Kailahum in Sierra Leone, and Foya in Liberia.
Many health experts believe cases are being underreported. Dr. Joanne Liu is with Doctors Without Borders.
It's like a front line. It's moving, it's advancing, but we have no clue how it's going to go around.
She spoke from headquarters in Geneva after a 10-day fact-finding mission to the infected areas.
I really had the feeling that it is like a wartime in terms of fear, general fear all over where you are, nobody not understanding what's going on.
The spread of the virus has slowed in Guinea. The humanitarian group Doctors Without Borders is building a new treatment center in Liberia.
So MSF is currently setting up this large management unit here at Alwa compound. It will be the largest structure we ever built with 120-bed capacity. We are also running a unit up in Foya in Lofa County in the north. Unfortunately, neither of these two units will be sufficient to cover for the need to isolate and care for the patients, because at this stage the outbreak is totally out of control, and we need to come up with other strategies to cope with the situation.
Liberian President Ellen Johnson Sirleaf declared a state of emergency August 8th and ordered border closings to try and stop the spreading Ebola virus across her country.
The scope and scale of the epidemic, the virulence and deadliness of the virus now exceed the capacity and statutory responsibility of any one government agency or ministry. The government and people of Liberia require extraordinary measures for the very survival of our state and for the protection of the lives of our people.
Roughly a quarter of Sierra Leone has been cordoned off by the government. Roadblocks staffed by soldiers and police who demand official authorization to pass. Mixed news from Nigeria. Officials there had said the outbreak was contained, but earlier this week, 3 fresh cases were reported, even as 4 earlier admitted to the isolation center in the Nigerian commercial capital Lagos were discharged. Paul Sisco, VOA News.